Making his debut here, we've got Mr. David Immelman. He is the CEO of DXS International, and more importantly, he's an Arsenal fan. Very good morning to you, David. How on earth did you end up being an Arsenal fan, being South African?
That's a long story. An old school friend of mine phoned me out of the blue in London one day, about 5 years ago. He lives in America now, and he said to me, hey, we hadn't seen each other since I was about 15.
Right.
And it turns out he flies here for every Arsenal game, and then started inviting me. I've never been to a professional football game in my life.
And
so then I felt kind of obliged to support Arsenal.
Very wise.
Yeah.
Okay, so you're the CEO of DXS International. Yeah. You've got a listing on NEX. The mnemonic is DXSP. Market cap circa £3 million.
We provide clinical decision support to healthcare professionals, currently mainly in the UK. And really what that boils down to is, if you use the UK as an example, you have about 40,000 general practitioners, many more nurses, etc. And these people every single day are making decisions, important decisions that affect people like you and I, and how to treat us. Information on how to treat people is readily available. The problem is there's massive overload. So what we do is we take this information from credible sources, and using technology, we present it to healthcare professionals at the point of decision making, i.e. usually when they're with the patient during the consultation. That's what's so important. So when a healthcare professional needs to decide, should they refer you to a hospital, to a consultant, what medicine to prescribe you, what care pathway to follow or care plan, our solutions are reading the patient's record and presenting this to the healthcare professional in a simple, instant, easily understood way, and helps them to make decisions.
Okay, so the national health.
Yeah.
Obviously, you've got a relationship there. You've got a relationship with the government. I saw your last set of numbers, and both had affected the bottom line. In terms of reorganisation and cuts and everything, okay, obviously, you know, you put on the report that globally 70% of healthcare costs are incurred by just 27% of the populace.
Yeah.
That's unlikely to change anytime soon, isn't it?
No.
So is this just, you know, the NHS and the government getting everything lined up to spend more in the future?
Every healthcare economy throughout the world has the same problem, just in varying degrees. And that is, A, that the majority of spend is on people with long-term conditions, i.e. such as diabetes,
right,
COPD. This is where the money goes. And there are recommended ways to treat these people, and they call that pathways, treatment pathways. The problem is how do you really get a busy healthcare professional to treat these guys in an effective way? Now, the NHS realizes, and they know, that this is what has to happen. They realize that digital technology is the way forward. But there's something else. You know, currently care is totally disconnected. And what I mean by that, you've got a GP, you've got a hospital, you've got social care, mental health care, but there's no connection really between these guys, and it's a real problem. So the NHS's aim currently is to focus on connected care, and in fact that's the term that's coined at the moment, making the patient central to care. And so that's where things are moving. You know, having different technologies, being able to interoperate with each other, and therefore being able to share that patient's care across all care. Now, of course, the NHS, you know, it's constantly up and down. We see this in the news all the time. You know, then we need to put more money in, and then it's budget cuts, and it's quite frankly often all over the show. But the core, the NHS's core, realizes what they have to do. And so, while at times it's quite a bumpy road, they have a goal, they have a vision, they have an aim. And I think that they're moving towards it in the right way. And that bodes well for companies such as ours.
Right. So in terms of 2018, new products, what if I was a shareholder, what could I expect in 2018?
Yeah, we've been innovating over the last 4 years, and we've specifically built 2 products that are more intelligent products to deal with these care pathways that I'm telling you about. Now, bear in mind, as I said, long-term conditions, 70% of the 120 billion a year, incurred by about 30% of the population. To reinforce the point, it's these care pathways that we need to present to practitioners in the most effective possible way. And so over the last 4 years, we've built products that are much more intelligent in dealing with these pathways. One of them will read your patient record in a GP practice. It'll assess where you are in terms of being compliant with one of these treatment pathways.
Right.
And then it will make recommendations to the practitioner to get you compliant. And once we can get you compliant with the way you should be treated, then that's ultimately will be the best result for the NHS, because that curbs costs. What it means is keeps you out of hospital. If you were a diabetic, and diabetics are recommended to have 15 health checks a year, as an example. More than 50% of diabetics have not had the requisite checks.
Right.
This means they end up in hospital with strokes, amputations, and so on. This can be prevented if you are treated in compliance with the recommended treatment pathway.
My father, when he was alive, he was a diabetic, and I'm sure he didn't do what he should have done. So.
Precisely.
Let's go back to, why did you list on NEX? And how's that helped in terms of the group itself?
Yeah. We needed some years ago to raise money. We were even a lot smaller than we are now. We were really starting out. And we had a bash at trying to list on AIM.
Yep.
And an honest broker at the time, recognizing my frustration, said to me, look, I want to give you some advice.
An honest broker, I like that.
I was kidding. And he said, I want to give you some advice. And he said, I think you should consider listing on this junior market. Anyway, he put us in touch with a corporate advisor who explained it to us. And so we did. We raised some money. But I think subsequently what it has done for us, it's given us the credibility from an investment perspective, transparency. So anyone out there knows that if you're listed on this market, you need to have followed and crossed all the T's and dotted the I's. And so I think that's primarily what it's done. I think that on the negative side, and it's not a big negative, I get feedback from potential investors, smaller type investors, who would like to have NEX make it easier for them to find brokers.
Yeah. Okay. Well, that's well documented, isn't it?
Yeah.
Okay. Well, let's wrap up. I always ask this to CEOs. Okay. 2018. Why should I consider having your shares in my portfolio? Have you got 3 reasons?
Well, we're an incredibly driven, dynamic company. We have amazing people with incredible domain knowledge about this industry. This has now been underpinned by some super innovative technology that we've developed. We're getting some seriously good feedback. And when you consider that the NHS are implementing a new tender program, we are an accredited company for the NHS as a supplier, but the new tender's out this year. And the exciting thing about the new tender is where the current one only deals with primary care, i.e. GPs, the new one is cross-care.
Right.
So that opens a huge additional marketplace for us in the NHS. So that's what's really exciting. And one of our new products is an app that is a patient app. We populate that with all your healthcare records, and that also starts to communicate with you as the patient about taking responsibility for your own health in terms of meeting these care pathway requirements that I was telling you about. And so those 3 reasons together are, for me, are potentially hugely exciting for the future.
David, on that note, we've run out of time. Thank you very much indeed for your time.
Okay.